have?
Central nervous system.
Central nervous system. Okay, so they're both central nervous system structures, the brain and the spinal cord. All right, name this entire structure right here. Cerebrum, name this structure. Cerebellum, name the structure.
Spinal cord.
Spinal cord. Can you see all those dark wiggly lines? Try that. I wish we were using the other camera. Okay, all those dark wiggly lines are actually blood vessels tucked down into little nooks and crannies. Can you see that the surface of the brain looks a bit wormy? That's because there are raised areas. This is a raised area that's sort of folding up and curling back. And then between them are little grooves. Can you see that? So the blood vessels are tucked down into the grooves. The little raised ridges, which have a lighter appearance, that is a gyrus. 2 or more are gyri. Okay? So these raised ridges are gyri. One is a gyrus. The grooves between them, where you find the blood vessels tucked down, okay, between those gyri, those grooves are called sulci. One is a sulcus. So all these little dark lines here, this one and this one and this one, those are all sulci. One is a sulcus. So far so good? The cerebrum is divided up into lobes. The lobes are named after their relative proximity to overlying cranial bones. So I bet you can guess what the names of the lobes are. What do you think these lobes in the front would be called? Frontal lobes. What about all the way in the back? Occipital lobes. And somewhere in between, parietal lobes. What if I turned it sideways and pointed to the side and said, name this lobe? Temporal. Easy. You guys okay with that? Okay. The cerebrum is divided into halves. There's a right half and a left half. Let's see if it improves if I turn on the light. Oh yeah, that's better, huh?
Yeah.
Okay. There's the right cerebral hemisphere and the left cerebral hemisphere, and there's actually a really deep groove between them, but there's some very delicate little connective tissue holding those together. Can you guys see? What's there? See that clear stuff underneath my probe? I just broke it. There's some more. There's some blood vessels I'm going to break too. See that? That clear stuff is called pia mater. Look down in there, you can see some more breaking. Do you guys see that? We can't split the brain completely in half. This groove, which I just lost a little piece of brain matter. Oops. Okay. This really deep groove that runs mid-sagittally, that's called the longitudinal fissure. Yeah, it's the 4th bullet point. We had to break through some pia mater to expose that longitudinal fissure. See this deep groove that my probe is in now? That's the longitudinal fissure. This fissure between the cerebrum and the cerebellum in humans extends into this plane. Name this plane. Transverse. Horizontal is an alternate name for it, but I'm going to go with transverse. And this groove between the cerebrum and the cerebellum is named the transverse fissure as a result. Okay, deep groove, fissure. This one's transverse fissure. Okay, now very, very carefully, if you gently pull down the cerebellum, pulling it away from the cerebrum, can you see something that sort of looks like a baby's butt sitting on a toilet seat? Did you guys see that? Okay. This entire structure, cheek on the left, cheek on the right, left half of the seat, right half of the seat, it has one name. It's called the corpora quadrigemina. Loosely translates into body made of 4 parts. Okay? Corpora quadrigemina. It's composed of the butt cheeks and the toilet seat. Those, whoops, there we go. Those butt cheeks are called superior colliculi. One is the superior colliculus, Both of them together are superior colliculi. What's the opposite of superior? Inferior. So guess what the toilet seat halves are called? Inferior colliculi or inferior colliculus. Singular, plural, different, still don't care. Won't through the semester, okay? We're going to look at that corpora quadrigemina again from a mid-sagittal section viewpoint as well. But be sure that you can identify it superficially like this. All right, any questions so far? Okay, let's see what's left on this back side. I think that's about it on the back side. And now I'm going to turn it over ventrally, and we're going to identify some structures on this side. All right, there are only limited cranial nerves that you have to learn on the sheep brain. The first set, you can't even see the actual nerves. You can only see the structures in which those nerves are embedded. Okay? See these sort of round flappy things right here? I'll show you they're a little bit loose. Loosely attached. See right there? See right here? Oops. Running through it, in fact running through here all the way through here, are the first pair of cranial nerves, olfactory one. So on the test, we could actually stick a pin in here and say, give the name and number of the structure or give the function of the structure. What would the function be? Sensory, good. All right. Do you guys see this X right here? See this X? The cut edge was cut kind of short, but it actually goes all the way out to the eyes, which are sort of laterally located on the sheep. Okay? Those are optic nerves. Optic nerve 2, the cut edges of this X. Optic nerve 2. The center of the X, dead center, is a special structure. It has a name. It's called the optic chiasma. And we're going to be able to identify this when we cut this in half as well. So you need to identify it superficially, and you need to identify it from a sectional standpoint. Optic chiasma, center of the X. Okay. It's kind of a mess right here, isn't it? That's because this is the pituitary gland. On the sheep brain, I'm not going to have you differentiate between anterior and posterior pituitary, but you should be able to identify the pituitary. This is the pituitary. Some of the brains in the sink have the pituitary still in place. Some of the brains in the sink may be missing the pituitary gland. If it's got a pituitary gland on it, you're going to have to remove it because it's covering up other assigned structures. Let me show you how you're going to do that. You're going to need some scissors. Okay, first of all, here's the pituitary gland. See this long sort of white structure? You can see it easily here, and then it's covered with other stuff up here. That's a cranial nerve. That's trigeminal 5. And that's assigned on the sheep brain. We've got to save that. When you tear off the pituitary, there's a bunch of tough white fibrous connective tissue wrapping a whole bunch of structures right here. And if you just rip off the pituitary, you're going to lose a whole bunch of details that you have to know on the sheep brain. So you're going to have to be careful about this. The other thing you're going to have to be careful about is, can you see this really skinny structure right here? See that? That's abducens 6. Here's another one. Abducens 6. If you just rip off the pituitary, you're going to lose those nerves too. So the first thing you want to do, get away from the surface of the brain, go up towards the pituitary, take the tip of your scissors, and just cut abducens really close to that block of tough stuff. Okay? Do the same thing over here. Did you guys see that? Okay. You need to save trigeminal 5 too. So this is where trigeminal 5 is emerging from the brain. I want you guys to go up about 1 centimeter and just cut through it like that. Same thing over here. Go up about 1 centimeter and just cut through it like that. You've got to cut those cranial nerves before you try to take off the pituitary gland. And if you're not comfortable doing this, you're afraid you're going to ruin your study specimen, I'd be happy to do it for you. I can do it pretty fast. Okay? Now what you want to do is lift up this edge of that pluck. There's going to be some blood vessels underneath here. Let's see if I can bring the light up to it. Okay, there's gonna be some blood vessels up underneath here. See that thing attached sort of in the middle? See it like that? I don't wanna pull too hard because then I'll just rip everything. Do you guys see that there's stuff attached? You don't wanna just rip it off. You wanna cut it as far away from the brain as you can. That's just a blood vessel though. Okay, this is where the pituitary attaches. You can actually pull that out. And it leaves a little hole behind. Okay, so this is what we took off. Move that up a bit now. Okay, this is what we took off. That can go in the trash or you can save it if you want, okay? And now we can see what else needs to be seen here. I'm just gonna push around some of that pia mater just to help reveal some things a little bit better. Okay. Let me zoom in. So we're zoom out. Focus, there we go. So do you guys see, here's that X? What's the center of the X called? Optic chiasma. Now, do you see this white structure after the X? Posterior to the X? Some guy in a lab that had been sniffing too many formaldehyde fumes or something thought it looked like a pair of breasts, and so he named it mammillary bodies.
What?
Yeah, that's what I say every semester, every time I look at this. Once in a while, you'll find a set of mammillary bodies that, instead of looking quite fused as a singular structure, has a little bit of cleavage between it, okay? I guess that's what he saw the first time, was the one that looked more cleaved.
Whatever.
All right. So that's that hole where I pulled out the stalk that holds the pituitary in place. That stalk is called the infundibulum. Sometimes you won't see a hole there because the part of the stalk is left behind. But you can use that as a landmark. There's the optic chiasma, then there's that little hole from the infundibulum, and then there's the mammillary body right there. Okay, so we've done the first two set of pairs of cranial nerves, right? We're going to do cranial nerves 3 and 5 and 6 and probably 11 before we're done. Here's the next pair of cranial nerves right here. See that? That's oculomotor 3. Oculomotor 3. Oculomotor 3, let me make sure you know what I do. Oculomotor 3 is found in this region right here. See this region right here? Over here and over here. These are called cerebral peduncles. Here and here, cerebral peduncles. You'll find cerebral, I'm going to back off a little bit now. You'll find cerebral peduncles between the optic chiasma with that centrally located mammillary body. They're going to be on either side, extending posteriorly from that region. And then they're going to end where you find this bump. Let me turn it. Can you guys really see that bump right there? This bump is called the pons. So cerebral peduncles extend on the sides, okay? Just a little lateral to midline, relatively speaking. This is a cerebral peduncle, this is a cerebral peduncle, and these oculomotor nerves lie on the cerebral peduncle. They cover part of it, although they're really small. Any questions so far? Okay. Here's trigeminal 5, really fat, huh? Do you guys remember the short, fat, stubby ones on the brain models? Well, these are also fat, but I cut them a bit longer than what you're used to seeing on the brain models. Trigeminal 5. Okay? Between them, you will find this bump. This is the pons. What's this thing at the end? Spinal cord. Do you see this thickened region of the brain that links up with the spinal cord? This thickened area between the spinal cord and the pons? This is called the medulla oblongata. Medulla oblongata. Now, if you look closely, between the medulla oblongata and the pons, you will find cranial nerve 6, which is abducens. There we go.